Thank you all for attending this presentation of our community health project. My colleagues Alaina, Cara, Caroline, Cleaver, Destin, Hänel, Jake, Nick, and I work together to examine the health outcome of COVID-19 cases and related deaths amongst those living in nursing facilities in the broader community of Lancaster County. This outcome is affected by various social determinants of health, which we will also address, along with some recommendations and resources for improving it. We will start by further defining our selected health outcome and giving some background on why we selected it.
As Mason has stated, we chose to examine COVID-19 cases and associated deaths among the nursing home populations of Lancaster County. When researching Lancaster County, two major health characteristics we found were exposure to poor air quality as well as an expansive geriatric population. Given the timeliness of the current global respiratory pandemic that is disproportionately lethal to the elderly or those with comorbidities, we wish to learn more about how this community was affected and how they are combating this crisis. We further know that COVID has had a disproportionate effect on persons of color and those with lower socioeconomic status, so we questioned if different nursing homes' economic statuses stratified their residents' health outcomes.
Diving more into our understanding of COVID-19's disproportionate impact on those with comorbidities and the elderly, we want to show how this pandemic has affected those in nursing homes and in long-term care facilities. The data presented in this project was collected on November 18th of 2020 and was gathered from the CDC, Center for Medicare and Medicaid Services, and Pennsylvania's Department of Health websites. In 3 sections, we compared the number of COVID-19 cases and COVID-19 related deaths occurring within nursing home facilities in relation to the general public. These comparisons were made in the scope of the United States, Pennsylvania, and Lancaster County, therefore looking at our relations in a macro, meso, and micro view. On November 18th, there was approximately 11 million coronavirus cases in the U.S., and about 300,000 of them pertaining to cases within nursing homes, making nursing homes only 3% of the total number of cases in the U.S. But when looking at deaths, there are approximately 250,000 COVID-related deaths in the U.S., and 65,000 of those occurred in nursing homes, rounding up to about 27% of national deaths due to coronavirus occurring within nursing homes.
This disproportionate trend in nursing home COVID-19 deaths magnified as we examined the state of Pennsylvania and Lancaster County. Nursing homes have garnered much of the national news attention related to the coverage of this pandemic due to articles such as this one from the New York Times. This has led to an increased focus on Lancaster County due to its number of care facilities. Specifically, Lancaster County has 32 nursing homes and an additional 63 long-term care facilities, which have required additional funding from the federal government at 2 different time points in an attempt to keep up with staffing, PPE, and COVID testing needs, in addition to the loss of revenue they have suffered from an inability to accommodate new residents. Lancaster County's demographics, logistical problems concerning these nursing homes, and disproportionate number of COVID deaths in nursing homes make it an interesting area of study.
After researching COVID infection rates at the macro, meso, and micro levels, we wanted to determine if various social determinants of health influence infection rate. First, we hypothesized that the nature of close quarters living in retirement communities allows for easy spread of COVID, and the social isolation experience could negatively contribute to outcomes. Second, the advanced age of residents puts them at a higher risk for COVID complications. Furthermore, we wanted to explore if the social economic status of the residents and the nursing home's financial capabilities and resources affected outcomes. If the nursing home had more resources, they might be better equipped to prevent spread, especially since operational costs have increased during the pandemic. Finally, cognitive decline and dementia may affect outcomes because those patients are generally more prone to negative health outcomes and may have difficulty complying with new guidelines.
In addition to the data we gathered on COVID-19 related deaths, we interviewed 4 different people with various roles in the Lancaster community. Dr. Ayesha Ahmad is a Penn State health physician in geriatric medicine who holds positions at Spring Creek and Frey Village nursing homes. She was able to give us some insight on how the pandemic was handled in nursing homes from a physician's perspective. Ms. Penny Fraunfelter is the clinical services specialist at Country Meadows Retirement Communities. She is responsible for coordinating the COVID response in all of the affiliated Country Meadows campuses and was able to compare the experience in Lancaster to different parts of Pennsylvania. Ms. Susan Noriega is the Vice President of Health Services at Fairmont Homes Retirement Communities. She was very helpful in informing us of the various difficulties they faced and provided some new perspectives on the issue. Mrs. Heidi Stoltzfus is the Executive Vice President of Mission Advancement at Tel High Retirement Communities. She was able to provide valuable comparisons to the other communities' responses and round out our sampling.
After speaking with all 4 interviewees, we noticed several challenges that were commonly experienced by each of the nursing facilities previously mentioned. These challenges are listed here. Social isolation of residents was an issue mentioned by all interviewees. Social isolation of residents led to cognitive decline in elderly residents and mental health challenges as residents could not socialize with each other or receive visits from their loved ones. Each nursing facility experienced the greatest challenges in controlling the spread of COVID-19 and their worst COVID-19 outbreaks in units where patients with dementia reside. This was attributed to extra difficulties in enforcing social distancing, mask wearing, and hand washing from patients with dementia who did not understand the larger reason behind these new policies. Our interviewees reported frustration with a lack of consistent guidelines from governing bodies, such as the Department of Health, for preventing outbreaks in nursing facilities. They had trouble keeping up with the frequent changes in guidelines and were often left to devise their own plans for preventing viral spread and handling COVID-19 outbreaks. Another common theme throughout our interviews was related to staffing. Nursing facilities experienced high staff turnover rates throughout the pandemic, especially in aide and tech positions. This was especially devastating because long-term relationships between providers and patients can serve to both improve patient mental health and well-being, and also help providers better and more quickly identify patients who fell ill due to COVID-19 or whose health was deteriorating for other reasons. We were told that many patients infected with COVID-19 were asymptomatic, except for extreme fatigue. But noticing this symptom requires knowledge of a patient's baseline energy levels, which can only be developed over the course of long-term, consistent care. Additionally, nursing facilities suffered from a lack of proper PPE training. Misuse of PPE unfortunately led to COVID-19 outbreaks, even when PPE was available and utilized. Finally, other issues that were faced by each nursing facility included lack of availability of resources, such as COVID-19 tests, UV lights, and other disinfecting supplies, as well as operational costs.
In light of this information, we've compiled solutions to improve COVID-19 outcomes in Lancaster County nursing homes. The CDC has many videos teaching proper use of PPE. Utilizing these resources to implement PPE trainings for all staff and residents and enforcing proper use can reduce viral spread. Additionally, we propose advocating to maintain Medicaid and Medicare coverage for COVID-19 testing for the duration of the pandemic. These measures can reduce the spread of COVID-19 and subsequent deaths. To improve staff experience, we recommend nursing homes implement a structured system of assigning caregivers responsibility for specific residents and provide mental health resources for employees to address the effects of increased death and isolation due to COVID-19. We also propose transitioning to in-house aid hiring instead of contracting with outside companies, developing opportunities for professional growth and promotions, and raising salaries. We believe these changes will provide incentive and a sense of connection to the nursing home in order to encourage continuing to work despite the challenging circumstances. There are also solutions such as increasing minimum wage for healthcare aides and increasing funding for nursing facilities. However, these measures would require legislation and government involvement. Additional barriers to our proposed solutions revolve around lack of control and uniformity, as every nursing home has different protocols and varies in access to resources. Additionally, it can be challenging to ensure that staff are adhering to new protocols. Potential solutions to these barriers include tracking PPE training participation and encouraging communication and collaboration between administrators of different nursing homes.
Upon completion of our project and analysis, we were left with a few major takeaways. Perhaps the largest of these is that the issue of COVID-related deaths in nursing homes is truly systemic in nature. As such, there is no one single solution to the problem. Rather, as my colleagues have already alluded to, resolving this issue will require a complex interplay between micro, meso, and macro level solutions. In addition, we learned that COVID highlighted systemic problems that already existed prior to the pandemic, such as low pay and lack of continuity of care. These concepts tie in nicely to a model that we learned about in class, the iceberg model. In this case, the observable event is the COVID-19 pandemic. Upon closer analysis, an important pattern underlying this issue is the disproportionately high death rates due to COVID in nursing homes. Underlying this are structures such as access to resources, staff diligence, reliability and turnover, and resident health status and isolation. And finally, underlying this are mental models, resistance to change, beliefs about COVID, administrative traditions, including staffing, wages, and outside help. The only way to truly fix this issue is to attack the problem from multiple angles. It is a systemic problem that requires a systemic solution. Not only will this improve patient outcomes and save lives, but also improve cost effectiveness and value of care. Thank you.